Hello guys, welcome to my YouTube channel. My name is Sarah, and on today's video I decided to talk about HIV AIDS because it's on 1st December and it's World's AIDS Day. So I decided to do this video so as to create awareness among the youths in Kenya and even around the whole world and to whom it may concern. So I've listed several questions, of which I'm going to be answering each question one by one. So the first question on my list is, what is AIDS? So AIDS is an acronym. The full meaning of AIDS is Acquired Immune Deficiency Syndrome. Okay, the next question is, what causes AIDS? AIDS is caused by a virus called HIV virus. HIV is also an acronym. The full meaning of HIV is Human Immunodeficiency Virus. And this HIV, it's a virus that affects the immune system of the body. And so the next question would be, who are at risk of getting HIV? So the following people are at risk of getting HIV. So the first category of people, these are people who abuse drugs, people who take excessive alcohol. This is because if you take excessive alcohol, it's going to affect your mind and you won't know what you'll be doing during that time when your mind won't be functioning well. And also those people who share needles, syringes for injecting drugs. For example, those people who usually inject themselves with those drugs like heroin, they're at high risk of acquiring HIV AIDS because they're sharing the same needles and syringes and they don't know if the other person who used those items had HIV. The next group of people who are at risk of acquiring HIV are people who have other STIs like gonorrhea, syphilis. These people are at high risk of acquiring HIV. If those STIs are not treated early, it can make them be at a higher risk of acquiring HIV. The other group of people are the health workers. All health workers are at a greater risk of acquiring HIV/AIDS because of accidental needle pricks in the hospitals. And the last group of people and the people who are at the highest risk of acquiring HIV/AIDS are the people having unprotected sexual intercourse. So the next question will be, how is HIV/AIDS transmitted? So HIV/AIDS is transmitted through body fluids, which include blood, breast milk, semen, and vaginal secretions. So these fluids, they can transmit HIV/AIDS. For example, for breast milk, if an infected mother breastfeeds their child, that child definitely is going to acquire HIV/AIDS. And then if you have unprotected sexual intercourse, the semen and the vaginal secretions, that's where the HIV virus will be transmitted from. Then HIV can also be transmitted through mother to child transmission at birth. So during birth, if the mother is infected and the mother's blood gets in contact with the child's blood, the child is going to get HIV/AIDS. HIV can also be transmitted through sharing sharp objects with an infected person. For example, if an infected person has been pricked with a needle and then you use the same needle, you're going to get HIV/AIDS. Then the other mode of transmission of HIV/AIDS is through blood transfusion from an infected person. But nowadays, this mode of transfusion is not very common because in the past the blood being nowadays blood is being screened before transfusion, so it's very rare for one to acquire HIV through blood transfusion nowadays. The next question is, what are the signs and symptoms of HIV/AIDS? So the signs and symptoms of HIV/AIDS are fever, headache, sore throat, unexplained weight loss, unexplained diarrhea, cough, and swelling of the lymph nodes, and sore throat. The next question is, how is HIV diagnosed? When you go to the hospital, or if you want to know you have HIV, what should you do? So if you want to know whether you have HIV or not, you should test for HIV, and by testing, for you to be tested, you need to go to the hospital, a VCT center, or you can test yourself. You can buy a self-testing kit and test yourself. So there is this antigen antibody test. This is the most commonly used method for testing HIV. So this antigen antibody test, there are of two types. There is the one that tests the blood, the one that is very common. I'll put a picture here, a photo of what I'm saying. So there is this, the one that uses blood, and then there is the one that has been invented recently. The one it's called oral quick self-testing kit. It's just something like a swab. You swab it in your mouth, on your gums, then you just taste. I'll paste the photo of the oral testing kit here for you to see. Then there is virological testing. For that one, you have to go to the hospital for you to be tested. So the next question is, how can we prevent HIV/AIDS? So if you want to prevent HIV/AIDS, if you want to prevent yourself from getting HIV/AIDS, first, if you have any STIs, you should go for testing. You should go for testing for you to know if you have any STIs and for you to treat them at an earlier stage. Because if you can remember, in the risk factors, one of the risk factors for getting HIV/AIDS is one who has another STI like gonorrhea. Yeah, so if you treat those STIs earlier, you can prevent yourself from getting HIV. Then the next one, and the most common one, is you should have protected sexual intercourse. You should never have unprotected sexual intercourse, no matter what, because if you have unprotected sexual intercourse with someone who is infected with HIV/AIDS, you are going to get HIV/AIDS. The next one is the males. They should practice voluntary circumcision, medical voluntary circumcision, yeah, to prevent HIV/AIDS. Then you can use PrEPs. PrEPs is an acronym. The full meaning of PrEPs is pre-exposure prophylaxis. These are the medications that you take before you get exposed to the HIV virus. For example, you can take these preps before having sexual intercourse and you won't get infected. Then there is PEPs. Now PEPs was pre-exposure and PEPs is post-exposure. After having sexual intercourse and maybe you don't know whether the person you had it with was infected or not, you can just rush to the hospital within 72 hours and get the PEPs, the post-exposure prophylaxis. Yeah, and you'll prevent yourself from acquiring HIV/AIDS. Then how do we treat HIV? How can you treat HIV? So maybe if you are HIV positive and you don't know what to do next, so this is what you should do. You should start taking ARTs in full is antiretroviral therapy. It's just the same as ARVs, but now ARTs, it's the combined medication for HIV/AIDS. So these ARTs, there is no cure for HIV/AIDS. So let me make that clear. There is no cure for HIV/AIDS, but it can be managed, it can be treated. So you just have to take the ARTs daily for the rest of your life. Yeah, that's the only treatment. So these ARTs, they strengthen your immune system. Remember, HIV is a virus that affects your immune system and it lowers your immune system. So these ARTs, they just help to reduce the multiplication of the HIV virus in your body and to strengthen your immune system so that you can continue living. Yeah, and then there are some tests that if you are HIV positive, you have to undertake these tests when you go to the hospital. So there is this CD4 count test and viral load test. So for CD4 count test, CD4 T cells count test. So these CD4 cells, they are the white blood cells that have been affected by the HIV virus. So you have to go to the hospital for you to know your CD4 count. If it's less than 200, it will mean that you have advanced from HIV to HIV/AIDS. Yeah, and then there is this viral load test. So this viral load test, it's the one that usually hear people nowadays, they usually say, I'm HIV undetectable. So HIV undetectable means that your viral load is very low. Your viral load is too low to infect someone. So if your viral load is very low, you cannot infect someone. That means that when you test with that test kit, the one that we usually use mostly at home, that antigen antibody test kit, if you use that kit, you'll test negative, whereas you're positive. That will mean that you've been taking your ARVs. You've been taking your ARVs strictly. Maybe if you are supposed to take at 9 a.m., you've been taking them at 9 a.m. every day without missing. So that means that your viral load will reduce and will be HIV undetectable, and even if you have unprotected sex with anyone, you won't infect them. But if you stop taking those drugs, your viral load will increase and you can infect them. Then something else, if you have HIV/AIDS and you're not taking your medication very well, you're at a high risk of getting opportunistic infections. Opportunistic infections are just these other diseases that someone will get when they have HIV/AIDS. These other diseases, apart from the HIV virus, Now if you start getting these other diseases, for example tuberculosis, cryptococcal meningitis, there are some cancers like lymphomas and Kaposi's sarcoma, and some bacterial infections. So those are opportunistic diseases. These are the diseases that you get after acquiring HIV/AIDS and you're not taking your medications well. So if you are HIV positive, you should just take it positively and take your medications very well, because HIV/AIDS, it's not a death sentence. People have been born with HIV/AIDS and they are still living, and if you just take your medications very well, you live until the day that your death had been planned for. You won't die earlier because you have HIV/AIDS. And then something else, today being World AIDS Day, I'm campaigning for no stigmatization. People should stop stigmatizing people who are HIV positive. It won't cost you anything to stop stigmatization. And then there are some myths and misconceptions about HIV/AIDS. Like some people believe if you share food with someone who's HIV positive, you are going to get HIV/AIDS. If you shake hands, if you hug, no, there is nothing like that. The only ways in which HIV can be transmitted are the ways that I've listed previously, but you cannot get HIV/AIDS by sitting next to a person who has HIV/AIDS. So if you know anyone who has HIV/AIDS, relatives or friends, don't stigmatize them by maybe running away from them when you see them, talking about them. No, when you do that, it's like you're shortening their lifespan. In fact, you should be friends with them. You should even be campaigning against stigmatization, because these people are our friends, our relatives, and they are people in the society, and we don't want them to die because of stigmatization. So as I end my video, I just want to ask you one question. Do you trust your partner? Have you tested for HIV/AIDS? Please kindly go and test today before the end of this 1st December. Make sure you go to a VCT center and test, because there are going to be very many camps or centers today for HIV testing. So go and test. Make sure you know your status by the end of today, and if you find out that you are negative, well and good. Continue protecting yourself. Continue using preventive measures. And if by any chance you find out that you are positive, just remember that it's not the end of life, and you can still push on by taking the medications and just living a positive life. So msipimane na macho, umesikia? Don't just look at someone and say that this person looks healthy, is not positive. You won't know, because some medications nowadays people are taking boosters, so they look healthy but they're not healthy. So make sure you know your HIV status and protect yourself. Bye. See you on my next